to start. Okay, we are now in live. I have people here in the virtual room, and I have to say hello of everybody. Yes,
Very
and we will start. We will start our presentation. I start first presenting our guest, and for that, I will share my little presentation for Dr. Let me go here. Okay, let me tell all of you the let me tell the little history about Dr. Laban. Okay, a little history. I want to be clear. Yes, it is a pleasure to introduce today's speaker, Dr. Osman Laban, that is a distinguished family medicine consultant and and in Emirates in the Emirates, and that's very good to be him here, not only as a presenter but also as our coordinator of the M.P.R International School in Dubai. Dr. El Laban have 35 years of experience in clinical practice, academic leadership, and residency program development. He is graduated on the American University of Beirut, is a fellow in the Royal College of General Practitioner in the UK, and holds the Arab Board in Family Medicine. Dr. Laban has served as co-director of the Family Medicine Residency Program at the Dubai Health Authority and has led family medicine departments in several major hospitals in the Emirates. And he is today, as I told you, our coordinator of the M.P.R International School. Today is a pleasure to me to present Dr. Laban. And I will give now I will give him the possibilities to talk. Let me stop to sharing my presentation. Yes. And hello, Osman. How are you?
Hello, everybody. Happy to be with you tonight.
Okay, for you is two now. For tonight for me in Spain is not night. We have 3 hours, 3 hours
Yes,
difference
yes.
between our country. But
Afternoon
that
for
is
you.
that is the live transmission. Yes, in
Yes,
the live transmission there is people who listen to us all around the world. Okay, if you like, I will share your presentation and we will start.
please,
What do you think? And we don't
please.
tell the people waiting more. Right? You ready?
I'm ready.
Okay, I am going now. I am going to share your presentation and you tell me if you see the presentation now. You see the presentation? Yes?
Yes, I can see the presentation,
And
and I would ask one favor that every time you can change for me the slide. I
yes,
will tell
when you
you
see
next.
next, I will change it. Okay? All right?
Okay.
Okay, and then you can close your camera, and I will close my camera also. Yes, okay.
Yes,
Okay, we'll close the camera and then we will start. I will put in a big screen now. Okay, you ready now? And when you go, I am going up and down with the
yes,
with the presentation.
yes. I am ready.
Okay.
Integrating M.P.R and posturology and posturometry into clinical practice. A modern diagnostic approach for unexplained musculoskeletal symptoms. Good evening, everybody. It's my pleasure to participate in this educational webinar today. My mission today that I will show a modern practical approach to diagnosing unexplained musculoskeletal symptoms by integrating multi-system postural assessment, and instrumental posturometry. My aim is to empower you with tools that reduce unnecessary testing and improve patient outcomes. Next, please. My agenda in this webinar is as follows: the importance of integrated diagnosis in modern clinical practice, the role of objective data and clinical posturometry in decision making through interdisciplinary collaboration between dentistry, physiotherapy, osteopathy, and other health sciences, to reflect on the philosophy and methodology and the global vision of M.P.R. International School. Next, please. Unexplained symptoms. In our practice, we face many unexplained symptoms, which create a real clinical problem. Next, please. The clinical problem we are facing that many patients remain symptomatic despite normal imaging. They report recurrent pain, fatigue, or imbalance even when x rays, MRI, and labs are unremarkable. Now, this creates a clinical frustration we all face. In terms, there is temporary relief followed by recurrence. So, our goal is to move from repeated symptomatic care to root cause identification. Next. Now, think of a patient who returns repeatedly with neck pain despite normal imaging and standard care. This highlights the limits of a single system thinking. It's prompt to ask what else could be driving persistent symptoms. Next, there must be a missing link. But what is this missing link? We have to remember that posture is not purely musculoskeletal. It is controlled by an integrated network: eyes, jaw, spine, pelvis, and feet. Now, what we do traditionally by single system assessment, we often miss these interactions. Now, recognizing posture as a multisystemic reframes our diagnostic approach. Next, please. Think about key symptoms that suggest multisystem postural dysfunction. Look for the patterns rather than isolated findings. When symptoms are recurrent or unexplained, consider a postural origin. Let us discuss the red flags that should raise your index of suspicion. Next, please. Recurrent or unexplained symptoms such as chronic neck, back pain, headaches, balance problems, fatigue, and asymmetric muscle tension are common presentations. Now, these symptoms are especially suspicious when imaging is inconclusive. So we have to keep a high index of suspicion for multi-system postural drivers. Next. If we are if we are thinking about the clinical suspicion, what are the key clinical clues? Symptoms that worsen after prolonged sitting or screen use, improvement with movement or stretching, and asymmetric tension or uneven pelvis or shoulders. The coexistence of jaw deviation with neck tension is a particularly telling sign. Next, the body has a network of sensors which continuously send signals to the brain. Next, how does the body normally maintain posture? Posture is maintained by an internal GPS. We have sensors in the eyes, inner ear, skin, and joint that feed the brain. The brain integrates this input, and postural muscles make continuous micro adjustment. Next, this figure symbolizes the multi-system connection. Next, no, go one slide back. Why does dysfunction in one system affect the whole posture? Posture operates as a closed feedback loop. If vision, mandibular position, or foot support changes, the brain redistributes muscle tone to compensate. Now, over time, these compensations can become maladaptive and painful. Next, now we come to clinical observation. Next, next, please. No, the one before. Clinical observation still matters, remains very essential. It helps in assessing of the body profile asymmetry, shoulder pelvic imbalance, limb length discrepancies. These visible signs often point to functional, not structural problems. Next. Now we come to clinical photographs. When you take photographs of your patient profile in different angles, clinical photographs provide objective baseline data and make subtle asymmetries visible. You can see where is the asymmetry. They are invaluable for tracking change over time. You can follow and see the change over time. And for communicating findings with patient and colleagues, you can show it to your patient, explain to him, talk to your colleagues. Next, please. Now we talk about some simple diagnostic tests that we can use in our clinic. Next. The three most high yield clinical tests that we are using simple high yield tests to raise diagnostic confidence. For example, neck flexion, extension, rotation to right, rotation to left, to evaluate the cervical tone. We use eye conversions and differential tests to separate a central versus peripheral oculomotor causes. And we use marsh and support tests to evaluate muscle chains and functional shifts. Now, these tests are quick and informative in a clinic. Next, please. Now, the advantage of modern approach. A modern approach integrates craniofacial, oculomotor, foot biomechanics, and biochemical markers. This holistic view uncovers root causes rather than treating symptoms in isolation. It enables personalized treatment strategies. Next, our roadmap to diagnosis. Diagnosis follows a clear flow, starting from taking a good history, focused physical exam, then use of instrumental diagnosis with using of posturometry and stabilometry. Now, this algorithm helps you move from suspicion to objective confirmation and targeted intervention. Next, one word about instrumental diagnosis. Instrumental assessment examines craniofacial load and system, oculomotor function, foot support, and metabolic contributors. Now, these tools quantify what we observe clinically and help in identifying the dominant dysfunctional system. Next, now we ask ourselves why instrumental assessment matters. Instrumental data converts our subjective observation into a measurable metrics. They distinguish compensatory from causative patterns and provide objective measures to follow up. This improves diagnostic accuracy and treatment tracking. Next, the message I want to say that instrumental assessment validates, not replaces, clinical judgment. Instrumental assessment is an addition, not a substitute, for clinical reasoning. Now, use of pulsometry, you can use it to confirm and refine your clinical hypothesis, not to override them. Next, please. This is we'll talk about describe the postometer machine next, and we'll talk about the postometry assessment next. What is a postometer? The postometer is a compact computer integrated platform that measures static and dynamic posture. It reports global alignment, weight distribution, center of gravity, and axial torsion. By this, it produces a functional profile of balance and stability. Next, please. Here is a real photo of a patient standing on the platform while the doctor assesses the parameters detected by the machine on his computer. Next. Now we can ask ourselves, how does it work? How a postometer works. Patients stand on a sensor platform 80 centimeters from the wall, while the system records lateral and anterior posterior shifts, foot loading, asymmetry, trunk head, angular deviation. The software in the computer calculates torsion angles, sway amplitude, and barycenter displacement. By the end, it produces a clear numeric and graphical output for comparison. Next, the clinical value of a postometer. Postometry is fast, reproducible, and clinically meaningful. It supports diagnosis, treatment planning, and outcome evaluation. And it detects postural load imbalances linked to pain and reduced quality of life. The good thing about this device that it can deliver a reliable assessment in less than 1 minute. Next, please. Now we come to a distinction. We have to distinguish between posturometry and stabilometry, which answer different clinical questions. Each one different, answer different questions. We have the posturometry tells us how the body is aligned. It is static assessment, focusing on symmetry, segment alignment, or how body weight is distributed. I'm sorry, how body weight is distributed. In simple words, posturometry helps in identifying where the postural imbalance is, whether the body is centered, shifted, or asymmetrically loaded. While stabilometry tells us how posture is controlled. Stabilometry is a dynamic assessment over time, analyzing balance regulation and postural sway. The key question in stabilometry is how stable the postural control system is and which sensory input, whether visual, vestibular, proprioceptive, may be underperforming. To summarize, posturometry shows alignment, while stabilometry shows us control. But together, they provide a comprehensive understanding of posture. Next, please. What posturometer reveals? Now, by changing the inputs through switching on and off of one of the inputs, we have the eye, we have the mouse, we have the foot. By switching on and off one of these inputs, we can reveal which system is driving the dysfunction. For example, in the inputs, we have the eyes open and eyes closed. We have mouse open, mouse closed, and we have the foot support. Now, this dynamic testing is a quite powerful diagnostic maneuver. Next, please. Now, the fundamentals of posturometry. Here's a few words about the fundamentals. In M.P.R posturometry, we use three standardized test conditions to understand how different sensory systems influence posture. We are playing with input from the eyes and from the mouse. And by changing this set of combination, we can tell. Let's start with open eyes and open mouth. This is our baseline condition, where all sensory inputs are available. It shows how the body organizes posture under normal conditions. Next comes closed eyes and open mouth. By removing the vision, we force the system to rely on vestibular and proprioceptive input. Now, any deterioration here indicate difficulty maintaining posture without visual compensation. The third condition is open eyes and closed mouth. Now we are testing a closed mouth effect. Here vision is preserved, but jaw proprioception is altered. This will influence the neck and craniomandibular system. Now, changes suggest a craniocervical contribution to postural imbalance. By comparing these three conditions, we can identify which sensory system is driving dysfunction and guide a targeted M.P.R intervention. Next, please. Now, this is a summary. Changing input reveals the faulty driver. This table summarizes typical patterns. Occlusion, when we have an open eyes and closed mouth. Oculomotor, where we have an open eyes and open mouth. Foot, when we have the eyes are foot, we have eyes closed and open mouth. So typical pattern: occlusion, oculomotor, and foot driver produce distinct eye-mouth response patterns. Use this as a quick reference during testing. Next, please. Now, one word about understanding stabilometry. Key parameters. We have the speed variance, which reflects how much the body accelerates and brakes while searching for the center of gravity. We have the comfort level, indicate comfort and efficiency of the postural tonic system. Paradoxically, a low comfort level means a higher comfort. This means we are reaching the comfort level very fast. That's why we are in a better comfort state. While a high comfort level indicate discomfort and instability. We have the oscillation report, OR. It predicts a dominant sway direction. Now, a low value speaks for a sagittal oscillation, which means the anterior posterior oscillation, while a high value speaks for lateral oscillation. Now, one word about the barycenter area. It reflects the muscle tone. A low barycenter area reflects hypertonia, I mean, because the flexibility of the muscle is limited. That's why the muscle is hypertonic. While a high pericenter area speaks for hypotonia. Now, a word on torsion, it measures rotation its way around the vertical axis. Elevated torsion suggests a convergence problem in the eyes. Next, please. How do we read finding on our computer, which is attached to the sensor platform where the patient stands? Next, please. In reading the findings, when reading the postometer screen, follow three quick steps. First, check the triangle orientation. If the load, if it points up, this means load variation is within a physiological range. If it points down, load variation is reduced, suggesting dysfunctional or protective loading. Second, we look for at the color of the triangle. Green means normal load. Yellow indicates mild alteration. Red reflects significant load disturbance. Finally, we assess the direction of the body load. Now, any consistent shift or change in direction indicate postural dysfunction. So, in brief, in M.P.R, we always interpret orientation, color, and direction together to understand compensation and guide treatment. Next, please. How to check each body system. For craniofacial assessment, we look for overload distribution, sagittal and lateral oscillation. For oculomotor, we look for refractive and convergence function. For the foot, we evaluate proprioception, whether the foot is varus or valgus mechanics, and consider food intolerance, metabolic or food intolerance contributor when muscle tone is abnormal. Next, let me give a a valid example of the functional scoliosis. Now, scoliosis is a very good example. It can be a functional or structural in etiology. Next. Now, functional scoliosis is very common, especially in children. Not all scoliosis is structural. Functional curves usually are flexible, posture dependent, and often reversible. This clearly warns that one specialty, for example, orthopedic alone, may miss multi-system drivers. Next, why team based diagnosis changes outcome? Functional scoliosis often has multiple drivers, whether craniofacial imbalance, oculomotor dysfunction, cervical tone, and foot biomechanics. Sorry. A team-based diagnostic approach ensures the root cause is identified and treated collaboratively. Next, why mu- sorry, why multi-system evaluation matters in functional scoliosis? Now, early multi-system evaluation can reverse functional curves before they become structural. In other words, early intervention changes prognosis. Next, what does M.P.R add to primary care? M.P.R enables earlier identification of postural drivers. It reduces unnecessary investigation, supports more targeted referrals, and improves how we explain condition to patients. It's a practical addition to primary care workflows. Next, please. What are the key take home messages? I want you to remember these messages that postural disorders are multisystemic, that clinical observation needs objective confirmation. We cannot depend merely on subjective assessment. A root cause diagnosis always beats symptom cycling, and collaboration improve outcomes. These are the principles to apply in everyday practice. Next, please. Why enroll in M.P.R course? Next. This is a moment where I invite you to reflect honestly on your own practice. Many of us see patients with persistent pain, imbalance, headaches, fatigue, or postural complaint, despite normal imaging and repeated referrals. The frustration is not lack of effort, it's a missing diagnostic framework. Now, M.P.R course is designed to give you that framework where to think of a multisystemic. This is not a theoretical course. Everything you learn is clinically applicable, whether you are in family medicine, dentistry, physiotherapy, rehabilitation, you pediatrician, or musculoskeletal care. In the course, you will learn how to identify the dominant dysfunction driver. Then you confirm it objectively, not subjectively. Understand compensations versus causes and collaborate more effectively across disciplines. Next, please. My last slide here about continuing on the process, elaborating on the enroll in the M.P.R course, it reduces the diagnostic uncertainty, improve patient trust, in us as a doctors, shortening the clinical journeys and elevates your professional confidence. If you want to move beyond cycling symptoms, this continuous cycling of remission of symptom recurrence and so on continuously. If you want a structure, an evidence-based multi-system approach to solve this problem, if you want to practice medicine with more clarity and impact, the M.P.R course was built for you. Thank you for listening.
Thank you so much, Dr. Osman. Thank you so much for the very, very nice presentation. So you're very good doctor, just explain these situations, no? And thank you so much. At the end, if the people who are here want to do some question, we will allow them to do that. And I will introduce. Let me stop sharing this, and I want to share a little presentation, just to, and then we will open again the talking with us. That's presenting our school. Yes, that is the meaning here. Let me 1 second. I will. I want to just not to do a lot of things about our school, but the first thing is to say welcome to our school. Today is a little presentation, is a very complex presentation today because we are transmitting here in the virtual room and also parallel in YouTube, Facebook, and LinkedIn. And this, but was very good the presentation. And today was we presenting in our school. We are a different vision, a vision of health care that move beyond the fragmentation of the body. Normally, medical science are fragmenting the body, as Dr. Osman said before. A vision that reconnect medicine. In M.P.R, you will speak the same language. A vision that transform isolated treatments into integrated rehabilitation. That's very important. M.P.R International School was born decades of clinical experience across different countries, cultures, and healthcare systems. We teach all around the world. It become as a final approach, treating a lot of patients, because modern healthcare requires more than specialization. Requires integration. Dentists, physicians, physiotherapists, osteopaths, and health professionals must speak the same clinical language. When this happens, rehabilitation becomes precise. That's very important. Outcomes become predictable and patient experience real transformation. This vision strongly resonate with the Middle East commitment to excellence, innovation, and leadership in healthcare. In the region, we will build our school under the direction of Dr. Osman. M.P.R International will contribute to this evolution in Middle East, not only as an educational institution, but as a global platform for what? For interdisciplinary excellence. And M.P.R International School educate all around the world. Programs for all medical sciences we teach across the world. And we are now building that in Dubai. But we teach in all these countries you are seeing there. America, from north to south, Europe, and Middle East. We teach in a lot of countries for many, many years ago. And M.P.R. International School was built more than 20 years ago with continuous education, continuous teaching, research, and hand clinical activity. But more importantly, it is built on thousands of real patient cases, complex, multidisciplinary, and challenging situations that demanded deep understanding and integrated solution. And that is the key of M.P.R. Our education is not based in theory, it's practically theory and practice. Every concept we teach has been tested in practice. And that is very, very, very important. Very, very important. We teach, we are arriving now to go to India, to Indonesia, to a lot of countries. It's very difficult to put in a picture the whole places where we are. We focus on integrated diagnosis and interdisciplinary treatment planning because I believe in my experience, I have 50 years of experience in modern healthcare. Isolated intervention often produce temporary results. When you integrate approaches, create stability and long-term functional balance. In our courses, mission is create and shared clinical language among professionals. When dentists, physicians, physiotherapists, osteopaths, osteopaths, and all medical science work together. And that's very, very, very important. Okay. But the most important thing is, I think so. The most important thing in our experience is the communication between health sciences. M.P.R. International School contributes to the evolution, offering structured, evidence-based, and clinical validated education designed to healthcare. Our programs are supported by strong academic and professional certification that ensure rigor, credibility, and international recognition. M.P.R. International School officially is associated with the Swiss Posturology Association of Interdiscipline, very important school in Switzerland, is associated with the Y University, that Y University certify our courses all around the world. This structure, that academic theory and practice, I think, is the goal in our school. M.P.R. integrate the whole medical science speaking the same language. I want to show you now our platform. Our platform is a dynamic platform. It's a platform when you can learn all the courses in theory, and you can learn at home. You can enter there. You can see courses. You have material in our platform, and you can complete the theory into our platform to go after that with the concept clear, go into the practice. And that is very important, very, very important, because you first do the theory at home when you want, the recorded videos, and you can learn at home. You can discuss with our professors in a live sessions online. This is our virtual room. Where you are is our virtual room, and you can deal with us, clarify doubts, and then when all is clear, you will go to the practice. And in that way, we can approve the practice 100% because you did the theory online. Okay, and this is the platform. This is our platform, and then I will tell you that it's very important to understand and to say thank you for your participation. Thank you so much for your participation. I would be very grateful for you to be here. Here or online, we have a lot of people who follow us online, and your presence reflects that you want to grow, you want to go up in your clinic, and I want to invite you for the next courses. Our first courses we will start will be the M.P.R fundamentals. M.P.R fundamentals is the basis of the whole philosophy of M.P.R. The M.P.R fundamentals is the basis of diagnosis and the tools to work. It's a very nice course that we have the theory online and the practical in place. And I have to say thank you so much, Dr. Osman, for your time. I'm very happy to be with you as a director in our school. You are a very great professional, a very great human being. We know for a long time, many years ago, we know, and now the dream is coming. We open the school. It's a project that we will work many years. We will think it many years, but was not the time. Now is the time to start the M.P.R International School in
Exactly.
Middle East, and with Dr. Osman as a coordinator. Thank you so much for everyone who are here and the people who are also in YouTube, in Facebook, and in LinkedIn. If here in the room everybody want to ask something, you can ask your hand and I will open the microphone. And if it's not, we will say bye bye everybody. And then I hope I will see a lot of people in our school, and we wait for you in the next webinar in our M.P.R International School. You want to say something, Dr. Osman, to say bye bye? Yes, for everybody.
Yes, I want to emphasize one point here. I want to thank you for giving me this opportunity. Where, as a medical doctor, I have been questioning about the value of the MPR. Now, the MPR, when it comes for clinical and practical, it comes into a part in the context of our clinical practice and help us to identify other other causes that may cause some functional maladaptive postural abnormalities. So I wish I could convey the message for all the attendees and welcome them to join our course. And thank you for
Thank you
coming
so
here.
much. And I have to say hello, everybody. We finish our lecture. I will stop the recorder now, and then we close the virtual room. And thank you so much, Dr. Osman, for your time and for your very excellent presentation for all
Thank you.
our audience in the whole socials and in our virtual room. Bye bye, everybody, and we see you in the next meeting. Bye bye.
Thank you. Bye bye.